Can MS cause transverse myelitis symptoms? Have you ever wondered if multiple sclerosis can lead to symptoms of transverse myelitis? The answer is yes, it can. To understand why, let's dive into what both conditions entail. Multiple sclerosis, often referred to as MS, is a chronic autoimmune disease. In MS, the immune system mistakenly attacks the myelin sheath, which is the protective covering around nerve fibers in the brain, optic nerves, and spinal cord. This damage can lead to a range of neurological symptoms. Transverse myelitis, on the other hand, is characterized by inflammation across a segment of the spinal cord. This inflammation disrupts nerve signals between the brain and the rest of the body. Common symptoms of transverse myelitis include back pain, muscle weakness or paralysis, sensory disturbances, and issues with bowel or bladder control. When MS affects the spinal cord, it can cause inflammation and damage similar to what occurs in transverse myelitis. In fact, a specific form of transverse myelitis known as partial transverse myelitis is more common in MS patients. This form typically affects only one side of the spinal cord cross-section. Interestingly, transverse myelitis can occur as a one-time event due to various causes, including infections or other autoimmune diseases. However, it can also be an early sign of MS. Many individuals who are initially diagnosed with transverse myelitis later receive a MS diagnosis, especially if additional brain lesions or other markers of MS are found during imaging tests or cerebrospinal fluid analysis. In summary, MS can indeed cause symptoms associated with transverse myelitis. Both conditions involve immune-mediated inflammation and demyelination of the spinal cord. Transverse myelitis in the context of MS may present as an acute episode of spinal cord inflammation, sometimes appearing before or alongside other MS symptoms. If you or someone you know experiences symptoms of transverse myelitis, it is crucial to seek prompt medical evaluation. Early treatment can significantly improve recovery and influence long-term management, particularly if MS is diagnosed. Treatment often involves anti-inflammatory therapies, such as corticosteroids, to help reduce spinal cord inflammation. Remember, it is always best to consult with a healthcare professional for personalized medical advice.